Childhood obesity is a growing health concern for America's youth. February is American Heart Month, and obesity is another thing that can affect the heart. So we're going to dispel some myths today with Dr. David Stone, a pediatric cardiologist with Corewell Health, Helen DeVos Children's Hospital. Doctor, thank you for joining us.
You bet. Thank you for having me.
So let's get to the first question or statement.
Okay.
Diets are just fads. True or false?
False. Diets really do work initially. The problem is when I hear the word diet, I hear temporary or something with an end point. We've had tremendous success here in our clinic changing the terminology and focus to nutrition as a lifestyle for long-term health. There's nothing wrong with doing these 30-day challenges and 60-day challenges if it gets you motivated, but we want to do something that sustains long-term health.
Okay, so this next one really had me curious. Low-carb diets are bad for your health. True or false?
False. So low-carb diets are extremely healthy, not just for your heart, but for your entire body. We would recommend your nutrition to include healthy protein, which would be things such as meat, chicken, fish, eggs are excellent sources. Healthy fats, which would include things like avocado and most of our nuts. And healthy carbs, which would be most of our vegetables, and I'm a big fan of blueberries.
They are delicious, aren't they? Okay, our next question.
But low carb is very healthy.
All right.
Absolutely.
Yeah, okay. So here's another one. If you eat fat, you'll be fat.
Great question. One of the biggest misnomers that we have is that eating fat leads to the storage of fat. I think it's important to break things down that our bodies either want to store fat or burn fat. And I think we could all agree that we want to burn fat and not store it. It's actually the unhealthy carbohydrates, sugar, fructose that lead to fat storage and not actually fat intake. However, it is important to emphasize it must be healthy fats that we're consuming.
Okay, we have another one here. Diets can be simple.
Okay.
True or false?
True. I'll flip the word again from diet to lifestyle change, a new way of life, but absolutely, not only can they be simple, they should be simple. One of the most common reasons why diets don't work, they're too complex, too much counting, too much calculating. Even these fancy applications on our phones can be very confusing. Keep things very simple. Counting calories isn't necessary. It's the type of calorie that we're consuming. If I put a calorie of a broccoli and a calorie of a donut next to you, same number of calories, they definitely work much differently in our body when we consume them. I think 3 simple rules that I would go by: if you're hungry, eat. If you're not hungry, don't eat. Think of food as fuel. Think of food as energy. Think of food as medicine.
Dr. Stone, some really easy advice there. Thank you so much for sharing that with us.
Absolutely. Keep things simple. Nutrition is the foundation of what we do.
Thank you.